Hello and welcome to a special edition of Reach Live. I'm Reena Sooch. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency, and we run all sorts of research within the digital health sphere. And I have the pleasure of being part of Reach Live and being a host for you. Normally it's on the last Friday of every month, but this is a special edition that we're doing today. This series is on leadership and resilience, particularly around clinician resilience, which is a huge passion of Reach. I urge you to check out resilience.healthcare, which is a big initiative that's being led and run by Reach. And it's an absolute pleasure to have the St. Peter's Healthcare System's president and CEO, Leslie Hirsch, here with me today. Les, welcome to this special edition of Reach Live.
Good morning, Reena. Great to be with you.
It's great to have you. So, Les, as we kick off, I'd love for you to introduce yourself, give an introduction to those listening about what you do and what your role is.
Sure. Good morning, everyone. My name is Les Hirsch, and I'm the president and CEO of St. Peter's Healthcare System, which is in New Brunswick, New Jersey. And the largest part of our healthcare system is St. Peter's University Hospital. And, again, that is also right in New Brunswick, New Jersey. And I've been in healthcare administration, hospital administration now for over 40 years with progressively responsible and diverse positions. And the last 17 out of 20 years, actually, I've been in Catholic healthcare. And earlier in my career was worked in secular organizations. So it's been a great run, and I've enjoyed it, and great honor to do what I do.
40 years of being in healthcare, that's no mean feat. It's a lot of experience. I'm always fascinated to know what leads people into the career that they're in. So I want to open with that, really. What led you to want to work in healthcare?
Probably two things. I always, as I was growing up, I was a competitive athlete, but I realized that the NBA was not going to be part of my future. So I wanted to be a lawyer, actually was really what I wanted to do. And then in my senior year of college, I had a change of heart and wasn't sure what I was going to do. And I started a graduate program in public administration. As a corollary to that, totally, separate issue. Growing up, I was probably exposed to hospitals more than the average kid or teenager. Both of my parents, especially my father, had some near-death experiences. So I did have experience or being inside of large hospitals, and with that situation, with my father in particular. So when I decided on healthcare, I just migrated automatically. To me, the center of the universe for healthcare was a hospital, and then just came to think about what I might do in the hospital, and I guess I had leadership tendencies, and so I just gravitated and thought, well, I'd like to pursue a career in hospital administration, and that's pretty much how I came to it.
Fascinating. So leadership comes with many challenges, many pressures. When you think about, that you've been in leadership roles for 30 plus years, what drives you? What motivates you in your role?
Yeah, and leadership is a very deep subject, and definitely there's a difference between leadership and management. They are distinctly different, but yet they overlap in terms of function. For me, leadership is really all about trust. It's about transparency. I'm an active communicator as a leader, whether it's through now a lot of video meetings, we used to do in-person town hall meetings, or just being accessible in the hallways of the institution and wherever I travel. So it is about relationships. It's about trust. It's about transparency, being being open and approachable. And so, I've always felt that how can one lead if you're not believable, and if people don't believe in what you're trying to lead them to, and if they don't trust you. So above all, there has to be trust, and that can never be breached. And if you're going to make a promise and give your word, keep it. I always say, short of an act of God or something extremely unusual, if I make a promise, I'm going to keep it. So credibility is important, and it's something that you build up over positive and repetitive acts over time. And so to me, that's really, these are core values in leadership.
Yeah, trust is absolutely, yeah, I couldn't agree more. And authenticity, right? People
Yeah.
seeing that, you're really truly in it for the right reasons and what have you. So you've seen, you've been part of the huge amount of change as well. So we often talk about the digital transformation of healthcare, the big changes that are happening. I always reflect on my own family, my own life, the kind of care my grandma had versus my mother versus how I see healthcare. And it's hugely different, and how proactive we all are have been in our health has changed and shifted
Hmm.
over our generations. For you, what are some of the most significant changes that you have seen?
Yeah. Well, gosh, over actually this month, April, is 43 years since I had my first job in a hospital back in April of 1979, when I started as an assistant, actually an administrative resident, working for the CEO of the hospital at the time, right near my hometown. So there's been remarkable changes. People are living longer, and science and technology, pharmacology has had a tremendous impact. Certainly technology, and in the old days, and this affected my own father. Back in the mid '70s, if you weren't feeling well and having symptoms potentially of a cardiac event coming, if your doctor was smart, they put you in the hospital under observation and waited to see what would happen. And certainly in the case, for my dad, he was fortunate, because when he went into cardiac arrest, at least he was being observed in a cardiac care unit. Today, that same patient doesn't sit and wait to see what happens. An intervention occurs. You may go to the cath lab, for a cardiac catheterization, have an intervention, prevent the damage from ever occurring, and, potentially death. So, if you think back over 40 years, there's been so many changes and advances in the care that's provided, and that has added to life expectancy. If you look at the industry, I said before that hospitals, I always saw hospitals as the center of the universe. Hospitals are still very, very important as an aspect of the healthcare system, but the focus is a lot different. There's many more competitors. The competitive landscape is grossly different with others, be it Walmart's, Walgreens, big box stores that have replaced the neighborhood pharmacies. They're healthcare providers now. And insurance companies are also into healthcare, and reimbursement, aspects of reimbursement, technology that's available. Even the formation of healthcare systems. When I started, it was in New Jersey, there were about 120 plus individual hospitals. Well, today there's only 71, and those 71, three of them are in three large systems, and there's probably only a handful, of half a dozen, six or seven, that are left, that are single hospital healthcare systems, and that have not yet formed larger enterprises. I mean, we, for instance, located in New Brunswick, New Jersey, we're one of the few remaining independent hospitals in the state, and we also have a merger pending into a larger healthcare system with one of New Jersey's, sometimes referred to as mega systems. We have a merger pending with the RWJ Barnabas Health system, and that merger is currently under review by the Federal Trade Commission.
Incredible amount of differences and changes over time. Yeah, you just kind of think of, like you say, kind of the really independent small hospitals which have kind of moved into large systems. You talked about cost, talked about obviously technology. How has this all impacted the clinician? Because we talk about resilience a lot, and the talk today is also about capacity building. What some of the things you're seeing in terms of the changing role of the clinician, and how do they cope with all these different changes as well? What's some of your views on that?
Clinicians have definitely changed. Just a couple of aspects that come to mind with changes in insurance, for instance, doctors are affected. Are they in network? Are they part of a participating plan by their own choice, or perhaps that they're not included in the plan by a particular insurer or payer? They make, in some cases, decisions whether to participate or not. In other cases, they are excluded. There's external reviews, third-party reviews, so there's other hands in the pot when it comes to the care that clinicians provide. Based on sometimes based on the person they're taking care of, the patient's insurance plan. So that's an aspect that's very different. Certainly, payment for those that are working independently as private practitioners, and you're seeing a lot of change. And when I grew up, they were single practitioners largely, and infrequently did you even see where there would be a second doctor in the group. So today, physicians are in groups more so than not, and it could be a small group and of 5 or 6 doctors. And in the old days, quote unquote, that would be a large group. But you're seeing physicians join much larger organizations as well. In some cases where there's hundreds of them in a group. You're seeing now private equity being involved in that. Many physicians have cashed out, have monetized their practices, and there's the onset of private equity is involved. So it's very different. The practice, the way medicine is organized is very different. Doctors have also migrated to hospitals that employ physicians as well in large groups. Like, for instance, at St. Peter's, we have a core group of doctors, probably 400 or so, that are active, even though our medical staff roster, those that have privileges at St. Peter's in one form or another, is 1,000 plus or minus. And we have 200 plus doctors that are employed at St. Peter's by St. Peter's, where they don't have to worry about participating, whether they do or not, in the insurance company, because in this plan or that, because we participate in all plans that we can. So, and then we also have community physicians. So there's a big impact in how the practice of medicine is organized today. There's also a lot, when you talk about resilience, about burnout, clinician burnout, be it nurses and others, and certainly physicians. We've just come off a very difficult period with the pandemic. And so a lot of burnout and a lot of resilience issues. Now there's tremendous workforce shortages. Very difficult. There's a nursing shortage unlike anything that I've seen. And I've seen a few nursing shortages over the years. And this one is even different. And the economics of this one is much different as well, how it's impacting us.
Yeah, so extraordinary to hear, because you have seen so much. The pandemic happened, and but you've been part of history, and you've seen so many different scenarios. So, how do you feel about where we're navigating? So, as a leader today, as you see these shortages, you see the kind of clinician burnout and the changing model of care. What are some of I don't know, is it prediction or not, or what some of the things that you're thinking about at this stage about how we're going to navigate ourselves out of this?
Well, yeah, Reena, big issue that we're facing right now. I'd say 2 big issues come to mind, not to say that they're the only issues, but I think they're very substantial. And if you read the healthcare literature, whether it's every day, seeing information coming out from the American Hospital Association, our state hospital association, and just the literature, popular source for many of us is modern healthcare. So there's a lot in there about some of the things that I've just discussed. but also the workforce shortages are really a substantial issue for us. And I mentioned about the nursing shortage, but it's not just the nursing shortage. It's also other allied health personnel, be it respiratory therapists, for instance, and even other workers. It's difficult finding the help that you need, the labor that you need, in other departments, service departments, be it maintenance, be it environmental services or food services, and the competition and the rates. We moved our minimum wage. Uh, I think it's at least going on 3 years now to $15 an hour, and at that time, the lowest wage in our institution was just barely reaching $10 an hour. And over a 2 year period, we quickly moved to $15 an hour, along with some other organizations, but ahead of, for instance, the legislation in the state that still is not, the minimum wage in our state is still not $15 an hour. And that was a big jump at the time. And we did that as a matter of, for us, as part of our mission, it's also a matter of justice and trying to move those that were on the lower end of the wage scale, to move them up, and recognizing how can someone live on $10 an hour, even 15 an hour. But that was a substantial change. Point I'm driving at is even $15 an hour today doesn't cut it when you have fast food chains and others offering $20 an hour or 22 or $23 an hour. So it's very, very difficult. And then there's the supply.
Mm.
um, there's many people that actually would love to go to nursing school. There's not a shortage of interest, but many of the schools don't have the ability and the infrastructure to be able to keep up with the demand,
Mm.
for it. And so, you need instructors and you need the infrastructure in a school to be able to keep up with the demand. Uh, so that's an issue. Also, the baby boom generation is retiring at a rapid rate. So, also coinciding with that is a higher rate of retirement. We're seeing that in our own hospital, where many people are at that age and they're retiring. And I guess I'm getting old enough where people ask me the same, and I'm not ready to retire yet by any means. I've still got a few years left in me, I hope, God willing.
Well, absolutely, yeah. We don't want you going anywhere. It's so interesting when you spell it out. I mean, it just feels it's quite overwhelming, when you really think and break down the challenges that we have and the workforce and the need for more training, yet we don't have enough infrastructure. And technology keeps coming up as a mechanism to help that, to help bridge the gap. So, what's your perspective on that? Is technology going to help us in this future? Is it helping us today? What's your view?
Oh, technology is to, I guess, use a phrase that some use sometimes. It's a huge game changer. When I look back over the years when I first started, so much has changed. Some of the things I've mentioned already, but certainly technology has just had an unbelievable impact. I think we're at a point right now where the electronic health records really is becoming a staple. And but in the old days, the years past, it was all paper driven, mostly paper driven. So and not just, the idea of an electronic health record gives you that interoperability that really is critical. And hopefully, the entire country someday, that there'll be consistent standards, um, that across, no matter where you are, that your health record will be accessible. But technology in all sorts is unbelievable. I watched up in our own laboratory, we have a very sophisticated system that was just put in. And it was amazing to watch that technology work as a specimen was finding its way through the different points along the line on that analyzer, but all driven by technology. And it's what's interesting about it is, if you think in terms of modern history and just look at the last 100 years, where we are in the last 10 years of that time, or the last 20 years. If you think of in the history of civilization, we're at a point where we have the greatest advances in technology that likely just serve as the foundation in many respects for where you can only imagine where it might go over the next 50, 100 years as things evolve. So technology is a huge game changer. It's also, it can be disruptive. I mean, one of the things that I worry about as much as anything today, when people say, what keeps you up at night? I worry about a cyber attack. And especially nowadays with some of the upset in the world and what's going on in Ukraine, and especially, but even before then, I mean, cyber attacks just, didn't come about in the last few weeks. They're a huge concern. And so a huge, very substantial focus for us is security, and making sure that you're not breached. And we have had a couple of experiences where our security was tested, and thank God so far we've been able to repel some of the attacks that have been made. In fact, all of the attacks that have been made on us, thank God, we've been able to repel them. But it's so real, and it's scary.
Yeah.
To think that there's somebody out there, not just somebody, but many out there that are criminally oriented, and they have the ability to do this and wreak havoc.
Yeah.
So technology is just incredible, and how that technology is also applied to biomedical equipment, and then how that is used and as part of all these advances that I've spoken about. That ultimately it's all about, can we extend life and quality of life, and at what cost? Because the cost equation is also a big deal. That wasn't an issue when I first started. In fact, reimbursement was based on cost. If you spent it, it was part of your cost, and you could justify getting reimbursed. But it's so much more complex today. It's like night and day.
Yeah, absolutely. I think technology providers really struggle with the fact that, you know, showing impact, showing that, by implementing our technology, you've achieved X outcome. Like you say, betterment of care is ultimately what you're looking for. You want to optimize individuals' care, you want to make it smoother and easier. How does that work for you in terms of the technology that you're bringing into the hospital? Do you have like a committee that kind of makes those decisions? Are you have like kind of how do you overview and measure the outcome of whether the technology is working?
Well, we certainly don't make those decisions in a vacuum. We've got a senior leadership team. I have a wonderful team that we work very well together, and a number of people on the team have been at St. Peter's longer than I. I think when I look at the team, uh, in addition to my role, there are 10 other senior leaders, and 8 of those 10 leaders have been there for a number of years. So when I came in, I did make some changes, but the people that are on this team, with the exception of just a couple, have all been there, and so they know St. Peter's. And I would say, for the size of organization we're about a $550 million organization in terms of our economic scale. We're pretty lean in senior leadership, and so we work as a team, looking at our needs. If you think in terms of an organization, and how it may be structured, and we work collaboratively with our medical staff leadership. So the physicians that are the clinicians, they know what they need, and administration and the medical staff, uh, our leadership, we work together to make sure that we can get the technology that they need for the care that they want to provide and need to provide. So that's how it works. And we do have a leadership committee that, when big capital projects come through, we review them, and then every year, we are governed by a board. We are a not-for-profit organization. We are a Catholic organization serving the community for 115 years up to this point, and plan on doing that for many, many, many years into the future. And we are sponsored by the Diocese of Metuchen in New Jersey, and work very closely with the bishop. And so our governing board, we also bring and report to them and big capital investments and get their approval. And we have a budget that part every year that we bring to them as a capital budget. And we do have some physicians on the board as well that also are on our governing board. So again, it's a strong partnership, and I don't know if I used this word before when you asked me about leadership, but collaboration, along with what I mentioned before about trust and transparency and being open in communications, but collaboration is also extremely critical.
Yeah. It's so lovely to hear that clinicians are heavily involved along with a multidisciplinary team. It's one of the things I hear most often in the work that I do with digital health is clinicians feeling like, well, we do this day to day and we want to be included in the
Yep.
decisions, which makes complete sense.
Yeah.
A piece of research we released recently called The Future of the Clinician talked about what the future role of a clinician will be. And what really came up high was this belief that they will need to be data literate. They'll need to have much better grasp of all these different technologies and the data that's coming through them. Is that something that if you think about the future of health, is that something you believe too? Is that a signal to the future that you believe we're going to have doctors having to understand lots of different data for health?
I think absolutely. There's no doubt about it. And, even if you look at, the multi-generations that are represented in an organization today. So no doubt about it, I'm a baby boomer. There's millennials, there's Gen X, and I don't even know all the names. But it seems like the younger and the earlier careerists that are coming in now are even that much more savvy when it comes to the use of technology. And fact is, they've grown up with it. I can remember when somebody was first teaching me how to do email on a computer, and so even how I've evolved, in my career. But when you think of those that are coming in, be they those that are in management and leadership and or in other technical related jobs, the younger and the earlier you know careerists are coming in, and they're definitely more tech savvy and tech adaptable. And you see that with physicians in training, medical students, residents. They are absolutely more savvy today when it comes to technology. So, and with that then comes an understanding. Physicians are data oriented as it is in terms of the science of medicine and understanding data around clinical outcomes and quality measures, and those that are more deeply ingrained in research. But I think even much more so as time goes on, the generations that are coming up will be even that much more adept because they're growing up with it in a way that the current generations did not. Certainly in my generation, I can remember putting a dime in a payphone and making a phone call on a payphone. And you talk to younger younger individuals about that sort of thing today, and they can't even begin to imagine it or imagine a television without a remote control. I mean, we used to get up and change the channel, and there were only a few of them. Only a few channels. So everything is different, and it will, as it relates to healthcare, will definitely be that much more advanced as time goes on. In fact, it can't help but be the way things are constantly evolving.
Les, it's been such a pleasure talking to you. I just feel, you've just such an incredible amount of experience, and just to hear all the things that, you've kind of thinking about in a leadership role is just so fascinating for me and everyone listening. So we really, really appreciate it. For those that are listening on demand or live, thank you for being with us. Les will be at the Leadership in Medicine, Empowering Physicians to Lead and Improve Healthcare, an event that's happening at the Hyatt Regency in Princeton on April 27. Get in touch with Reach directly if you want to have more information. Les, thank you for spending your Friday with us. I wish you and those listening a very happy Easter. And for those that are on live now, we'll be back at 11 a.m. Eastern with Tom Scott of Central State. But for now, Les, I'll give you the final goodbye. Thank you so much for being with us.
Thank you, Reena, and best wishes to all for happy holidays. And it's been my pleasure and happy to be with you this morning.
Thank you so much.
Thank you.